Hello there, I'm Dr. Daniel from Royal Medicals. The first condition we are going to begin with is going to be syphilis. There's a reason why I'm beginning with syphilis or all urinary tract infections. And it's not because I just love to talk about it, but it's the most serious of all. Syphilis has a history of being the most deadly urinary tract infection ever in history, because in the early 1900s, before World War, there were no antibiotics. They had not yet been discovered, and wherever you got syphilis, you just knew you were going to die. But right now, the treatment is there, the management is there, very simple, and you can always get saved through this most simple management which is around. So we are going to begin by understanding that most of these urinary tract infections are basically sexually transmitted. Yes, we can inherit them from your mother at birth, like we have congenital syphilis. You can get them from your urinals. For example, there are some urinary tract infections, because women are really at risk because of their urinary system, the way it was made. They can pick them from toiletries and what have you. But sexually transmitted infections are especially most commonly transmitted due to exposure. When you have unprotected intercourse with an infected person, you will always be at risk of these conditions. That's why protection is key. Prevention is the first step, nothing else. When you prevent a condition, you are 100 times safer than a person who is looking for the best treatment out there. So syphilis is a sexually transmitted infection that is caused by a bacteria that is very persistent. We can only know that when you go through this stage. This bacteria can take you through 4 stages of this condition, whereby you have the primary stage, which presents in a simple way with painless sore, which appears around the genitals or the anal region, and within like 3 weeks of exposure. But these will heal and they will disappear, and that's where problems come in from. Some people think, I don't know what was happening, but I think I'm fine. But they don't know that they're harboring the real problem. So it's always good, whenever you notice any issue with your genitourinary system, rush immediately and go and do a checkup. So that is the primary stage. Painless sore, 3 to 6 weeks, it's disappeared. But the secondary stage will always come. And this secondary stage now comes with more symptoms. Not only the sores, but now it comes with skin rashes, sores around the mouth. You have leg symptoms, so it goes on increasing. This one can happen after like 3 to 6 months. Then it will also go. Then you enter into the latent stage. Now the latent stage depends on how immune competent you are. If you have no any other underlying disease, if your immunity is very okay, you're very safe, the latent stages can even take 15 years. That's why you find a child who was born, has no immune compromising condition like HIV. This child may even begin developing symptoms of syphilis, the tertiary stage, after like even 20 years. So, but if you have something which has co-infected you, syphilis is likely to show up very early. So if you don't treat this, the latent stage, you won't see any symptom, but the tertiary stage will come with severe symptoms. It will always present with symptoms depending on the organ it has attacked. If it attacks the eye, you will present with blurring of vision. You can even go into blindness. If it attacks your gonads, you may end up with infertility. If it attacks your brain, you may end up with reduced mental processes. You can even go into mental disorder. So tertiary syphilis is deadly. That's why I chose this to be the first condition we share about. Syphilis is no joke. You should make sure you don't stay with it. Make sure you check yourself and make sure you manage it in time. We have laboratory tests all around. We can do this syphilis check in our labs, and the best treatments are out there. Even if they tell you we are going to give you this injection on your bums every week, 2 injections on a single day, for 4 weeks, please just obey what the medics are telling you. It's for the betterment of your health. You may always, I see ladies say, "So can't I get some drug of the cannula?" Please, please, please. If that's the treatment they have recommended for you, better take it other than looking for a solution which won't work for you. You may look for a solution in your own thinking and you end up being taken the wrong direction. So syphilis can cause, you can even develop cardiovascular syphilis. I want to make a special video about syphilis of the heart. You may think you have pressure, you may think you have what? You're presenting with chest pain, you are suffering, but it is syphilis which has just attacked your heart. So syphilis is deadly, is serious, so we better give it the attention it deserves. So I request all of you out there who are cautious of your health, wherever you develop urinary symptoms, you have painful micturition, you have pain, always report and go for checkup. Whenever you're checking up for STIs, never forget syphilis, never, because it is a very, very bad condition to ever have. It gives you a lot of freedom, but it can destroy you. So that's all we have to share about syphilis. If you have any questions, reach out. The details are in the bio. Mukisa Daniel over here at Royal Medicals. We are happy to have you. We are happy to listen from you. And always we shall be there out to help you. 07777, that is code 7 25844. Reach out. Peace.